Okay, this video is it all the same disease? And what I'm going to talk about is just, how medicine works. And for example, I had a conversation with an internal medicine doctor recently, and, he's a super brilliant guy. He's like one of the smartest interns you'll ever meet in your life, IQ probably 150 or higher. And, but I noticed he's got a little bit of a gut, a little bit of a belly on him. And I said, you know what? You should be watching my videos, New Year's resolution, go low fat, low sodium vegan. Turn your belly around, get skinny. And he's like, yeah, I gotta start looking into that. He's distracted with other things. And so what I would say is, the problem why even the smartest, he's the smartest of the smartest internal medicine doctors, he doesn't know the basics. He doesn't know the low-fat vegan diet, okay? So I teased him. I said, the problem with you guys is you don't know the basics. You don't know my mnemonic nets. Nutrition, epidemiology, toxicology, and then things that start with the S. Spirituality like religion, sleep, sedentary versus exercise, sense of purpose, that sort of stuff, how that affects health, and understanding stress, its relationship to caffeine, and everything else. Okay, so anyways, how does medicine work? There's a saying in medicine, when you hear hoofbeats, you think of a horse. Okay, and a horse, when it comes to diseases, everybody, all the patients practically got obesity, fatty liver, diabetes, hypertension, leading to atherosclerosis, meaning coronary artery disease, myocardial infarction, atrial fibrillation, and there's a lot of cancer, kidney stones, and all that stuff. GERD, abdominal pressure syndrome, strokes, cognitive decline. Okay, anyways, that's horses. But medicine doesn't think about that. Medicine, when it hears hoofbeats, it looks for zebras, rare things, or it'll look for okapis, like a sort of a combination of a zebra and a giraffe. Or even, everybody's always worried about unicorns, things that don't even exist. Protein deficiency, calcium deficiency in a Western patient. Okay. It's a big joke, okay? MD means medications or drugs rather than food. All right, so anyways, here is a little bit about cancer. Here's a liver, and basically people eat the high-fat diets, they get a fatty liver. If they continually have a high-fat liver, a fatty liver, they're at risk to develop NASH, non-alcoholic steatohepatitis, meaning inflammation of the liver. Inflammation often heals with fibrosis, scarring, collagen, and that becomes cirrhosis. Cirrhosis has areas of ischemia, and those areas of ischemia, lack of oxygen delivery to tissues, can become damaged and undergo the Warburg effect. So lack of oxygen can injure the mitochondria and cause the cell to transform into cancer. That's called the Warburg effect after Otto Warburg. And that's a mechanism for cancer anywhere in the body. Anywhere you got a lack of oxygen, damage the mitochondria, the cell reverts to becoming an anaerobic, largely anaerobic cell. This occurs all over the body, okay? High-fat diets cause ischemia. They increase the risk of cancer. Meat and processed food are big sources of that. Okay, here's a simple thing. Like, you walk into some big building or a tourist place, and they'll say, you are here on the map, and you can do what the typical stupid chump does, eat a lot of meat, oil, processed foods, drug to treat it. The drugs don't work. Then they go for surgeries, chop, 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 bye-bye money, prematurely cognitively impaired, weak, dead by 70 years of age. That's man's way. It's expensive, it's painful, and it seldom works. You're not going to cure a dietary disease with a pill. Okay, and then here's God's way, all right? Become a low-fat, low-sodium vegan with no oils. Avoid toxins, avoid EMF. Your Johnson's going to work a lot longer. You don't need to take pills hardly, or you don't need any surgery probably. I'm 60 years old. I don't take any pills. I've never had any surgeries. I don't expect to any time in my life. It's not normal to take pills. It's not normal to have surgery. Okay, get your sunshine, exercise, sleep, help other people. That helps you too. Maintain some type of social support network. Practice your religion. The major religions, everybody who practices the major religions, they're all healthier. And that's called God's way, and it's free, and it usually works. And the reason nobody talks about it is because it's free. Low-fat vegans don't need the healthcare system, hardly ever. So the healthcare system's not going to teach them that. It's a business, okay? All right, here's a Tower of Babel. And like I said, all the internal medicine textbooks are a joke. Psychology textbooks are a joke. Psychiatry textbooks are a joke. And a lot of the other fields that are better, they're still at least half a joke. The neurology textbooks are half a joke. Okay, so you say, how could I say that? Isn't that arrogant to me? No, it's freaking obvious. If you just look at it, it's totally obvious. So here's what they all say. Let's say about coronary artery disease or something. They all say the same thing. It is a hypertension. main risk factor for atherosclerosis. It is associated with aging, partly genetic. Nobody knows what caused it. It's idiopathic. The doctor's an idiot and the patient's pathetic. Might as well take our pill and try to slow it down. Allopathic medicine, match the ill to the pill, send the bill. The painting, by the way, is Tower of Babel by Peter Bruegel. Okay, Peter Bruegel. All right, so what basically happens? You turn the patient into a chump. You turn the patient into a cow, and you milk them every day. You take a little bit of money out of their pocket every day that they got to pay for their pills, and they never get better. Okay, and then it's not rocket science. If you want the patient to get better, let's say you buy a brand new car, an expensive car. What are you going to do? And the owner's manual says put premium gas in. You're going to put premium gas in there. Okay, if you got a car that requires premium gas, let's say the human body, low-fat vegan diet's premium gas, it's totally stupid to put the standard American diet in there, okay? And it's best to put the low-fat, low-sodium vegan diet in there with no oils. There's other versions of it, the Mediterranean diet, the high-fat phony diet. It's a lot better than the standard American diet, but you could still do significantly better than that. Just put the right gas in your car. And starches are the right gas. McDougall said if you want to start getting healthy, just eat 90% of your calories from starch, 5% from fruits, 5% from vegetables. And the reason is starch is a polymer of glucose, so it's low in caloric density, and it stretches the stomach, causing early satisfaction of hunger. Then when the starch enters the intestinal tract, small intestine, it takes time for the enzymes of digestion to peel the fiber away from the glucose. So the glucose is gradually, slowly absorbed, and you get this slow increase in blood glucose, and it stays normal a prolonged amount of time. If you just have simple sugars with no fibers, you spike your blood glucose relatively rapidly. Pancreas overcompensates, blood glucose level comes down rapidly. That's called rebound hypoglycemia. The person guzzles more sugar, caffeine, and whatnot, and then it spikes again. They end up with a roller coaster blood glucose curve. Okay, so you don't want that. Just eat your starches, and you get the equivalent of a slow-release energy pill. And you're skinny, You look at rice eaters, 1 billion out of 1 billion of them are skinny. Okay, Dr. McDougall said all long-standing healthy populations eat a starch-based diet. There are no exceptions. John McDougall, best doctor who ever lived. Yeah, so this is a C.S. Lewis quote. He said, spiritually, we are designed to run on Christ. Well, metabolically, we are designed to run on starch. And that is true. Okay, and then we went over some of the epidemiology a little bit in like part 1 or something of this. Is it all one disease? And it's always the same. When populations go from eating predominantly plant-based diet in their traditional ways and start eating more westernized diets with more meat, more oils, more processed food, they always get fatter and sicker. It's always that way. Okay, so now we've kind of gone through a lot of stuff. We've gone through the epidemiology of different populations. This is the 5 or 6 blind men and an elephant, the Indian proverb. The first guy feels the tail, says it's a rope. Second guy feels the side, it's a wall. Feels the leg, says it's a tree trunk. Okay, feels the ear, says it's a rug. And the point of it is, you don't want to jump to conclusions right away. You want to study it for a while. And after you study it for a while, what you realize, what this internal medicine doctor said to me, he goes, the low-fat vegan diet is the only way to make sense out of health. And it's internally consistent. It's consistent across the epidemiology. It's consistent across clinical experience, the published literature. It's consistent across personal experience. It's consistent across animal studies, migration studies, anthropology studies, the biochemistry, molecular biology. It works in all these ways. Whereas, I looked at meat. Meat increases your risk of cancer in 30 different ways. I gave a lecture about that before. High-fat diets increase your risk of cancer, obesity, hypertension, diabetes, immune suppression, leaky gut. They're all bad, okay? How can you make that into a winner? You got to polish a turd, okay? I'm almost done with this talk. You want to get a bird's eye view here? I got to let somebody in my door. Let me just finish my slides super fast here. Okay, cancer screening is a big joke. You're just turning people into patients, like throwing a net over them. We previously went over the vulture versus the turtle versus the rabbit. Okay, then you're stuck forever like Hotel California. I'll be right there. Got somebody at my door here. Let's see. I'm almost done with this talk. Okay, and then if you eat the high-fat meal, you make your blood thicker. You release myeloperoxidase from your neutrophils. They cause inflammation. They damage your endothelial glycocalyx. Makes it more thrombogenic. You're predisposed to forming blood clots, forming atherosclerosis. It distorts the shape of some of your red blood cells, making them less able to deliver oxygen. You also get phosphatidylserine externalization from inner to outer leaflet of the plasma membrane of your red blood cells, making your red blood cells less deformable, increasing blood viscosity. You get microvascular angina. You get postprandial endotoxemia. I'll be right there. okay, and you get coronary syndrome X. It's all bad. And then the estrogens make you fat. You look like a pregnant female. It's not a beer belly. It's a pregnant female belly. And then I talked about excitotoxicity and how that makes people anxious. Here's some of the pioneers. So anyways, that's all I got time to do here. But the bottom line is most of it's all the same disease, and you can prevent almost all of it or cure most of it just by going low-fat, low-sodium vegan. It's a smart thing to do. It's what any intelligent person would do. I hope you find that helpful.